Hello friends, how are you? This is Dr. Sri Nagi, Ayurveda and Medicine Doctor and also Isha Hatha Yoga teacher. So today in this video I am going to talk about why my blood pressure doesn't come to normal. It has been seen many times whenever our blood pressure, that is BP, that is in common language that we see, or hypertension, why my blood pressure doesn't touch normal, why it is not possible to have a normal blood pressure that is 120 by 80 mm of Hg, or you can understand it as just 120 by 80. Why it's not happening? So let's see what Ayurveda has to say about it. Actually, the thing about blood pressure that you need to know is, for most of the people, the blood pressure is a disease itself. Many times it has been seen like people consider blood pressure as a disease itself. But actually blood pressure is not a disease, it is a symptom. And the root cause is lying beneath it. So what we do whenever we have high blood pressure, we go and we pop a pill. We check our blood pressure, and if blood pressure is high, we just consume some pill just to normalize your blood pressure. No doubt it is also important to keep your blood pressure to the normal, as our Western medicine also say these things, and it is needed also. But blood pressure itself is not a disease, it is a symptom, and disease lies beneath it. Whenever we are treating any disease in Ayurveda, we go to the depth, we go to remove the root cause, because I feel it is sensible. Many people does this mistake that they just remove the symptom and assuming that their blood pressure will go normal, or somehow chemically the balance in the body will come. And the problem with most of these cases is just unawareness. So about hypertension or high BP, we need to know that there can be many causes behind them. For example, there are certain hypertensions or high blood pressures that are because of kidney disease. There are certain blood pressures which are because of cardiac disease. There are certain blood pressures who are stress related. There are certain blood pressures which happens because of obesity, because of high cholesterols, because of some arterial disease. So blood pressure is just a symptom, it is not a disease in itself. And sometimes when we are not able to find the underlying cause of blood pressure, we recommend it as essential hypertension. Sometimes also this happens that we are taking certain drugs for certain diseases or certain chronic ailments, and that cause hypertension. So it is not if somebody has blood pressure, just pop a pill. Make sure that you rule out the cause, what is the underlying cause behind that, and try to treat that disease, because once the root cause will be treated, this blood pressure will subside to normal by itself. You need not to do any specific thing about it, but still the root cause is not being treated. We need to have hypertension as a symptom, because body has its own intelligence and it's saying to us like, we have blood pressure, treat the root cause. In Ayurveda, how we approach blood pressure, like in Ayurveda there is no disease itself has been mentioned like blood pressure, because blood pressure is considered as a symptom, it is not considered as a disease itself. The disease is underlying. So in Ayurveda there is different kind of medicines for treating heart, there are different kind of medicines for treating kidney disease, there are various kind of other medicine for treating other causes, because in Ayurveda they treat the mainly your digestive fire and 13 types of fires that are present in your body. And various kind of Rasayan Chikitsa is there, that is to making the organ. Rasayan Chikitsa means the organ, like we have various internal organs, how to make them healthy, how to make them stronger. For example, if your blood pressure is because of some kidney disease, then in Ayurveda they will give you various kind of tonics that are that are helpful to make your kidney very healthy. And once your organ will become healthy, naturally the symptom, that is blood pressure, it will subside naturally. So if you ask me under which disease Ayurveda has mentioned blood pressure, there is no disease in itself. It is just considered as symptom of underlying disease. While treating underlying cause, it's very important that you deal with, that you change your lifestyle, do yoga, pranayam, asanas, if your blood pressure is little bit higher, and if it is too much higher that you can't even stand properly, then at least you can do pranayam, just sitting and focus on your breath. Try to release more and more stress so that it will not create extra burden on your, extra tension on your system. That's all about why we are not able to cure blood pressure. I hope you will get certain clues. Also focus on your diet and lifestyle, and still if you have some questions, please write down those questions in the comment section. I will try to answer your questions in the best possible way. So that's all for today's video. Thank you so much for watching, and if you're watching me for the first time, there is a bell icon, there is a subscription button. Please click the bell icon, hit the subscription button so that you stay in tune with our upcoming videos. Also, if you would like to support us, there is a join button near subscription button. You can click this join button and you can support us. Those of you who want to have Ayurveda consultations, please write to me on this given email ID and I will let you know how we can schedule it. With this note, I would like to say stay healthy, stay blessed, take care. Bye.